Good morning, everybody. So, today we're going to be going over specific mental illnesses. But first, I want you to think about who remembers what we covered yesterday. So, if you remember, yesterday we covered the stigma surrounding mental illness. So, as we're going over today, I want you to think about yesterday. And the three things that we're going to be covering over, the first one is depression, the second one is anxiety, and the last one will be schizophrenia. So I want you to think about those right now and think of the different stigma that could be surrounding those mental illnesses. Also, as we're going over them, I want you to think about what you already know. I want you to compare what you learned to the things that you already have heard about the illness. Are they basically what you understood them to be? Are they different from what you thought? And does anybody that you know possibly suffer from these mental illnesses? So we are going to go ahead and jump into it. Let me pull up the PowerPoint. There we go. There we go. All right. So, mental disorders. First one, depression. So, I know a lot of people either know somebody with depression, maybe you even have depression. Depression doesn't always have to last your entire life. Sometimes something could happen and you just have it for a few months and then pretty much goes away. Some people with chronic depression, it may last a lifetime. So, symptoms: feelings of sadness, tearfulness, emptiness, or hopelessness. You may have angry outbursts, irritability, even over small things that you really feel like maybe you shouldn't just get that upset over. Loss of interest or pleasure in most or all normal activities, sex, hobbies, sports. So, if you used to love, it's like playing football, basketball, or your hobbies at home, maybe you like to grow gardens, collect things that used to bring you major enjoyment. But all of a sudden, there's no interest in you doing them anymore. You don't get happy, they don't make you excited. That could be a sign of depression. Sleep disturbances like insomnia or sleeping too much. If you lie awake at night and you just cannot go to sleep, or that's pretty much all you do is lay in the bed and sleep, those could be symptoms of depression. Lack of energy. So even small tasks take extra effort. That could be one reason that you are sleeping too much. There's no, everything just takes everything out of you to do. That could be a symptom. Reduced appetite, weight loss, or increased cravings for food and weight gain. Either or. If something all of a sudden, rapidly out of nowhere, you ain't doing anything really different, that it's not always that's probably not very good, and it could be a sign of depression. Anxiety, agitation, or restlessness. So if you're constantly getting agitated about things, you're real anxious over everything, you're you can't basically it'd be kind of like insomnia. You can't get still or get comfortable. That could be sign of um, depression. Slow thinking, speaking, or body movements. If when you used to be able to think real fast, everything came real clear. You can't move as quickly. Those are all symptoms that could be symptoms of depression. Feelings of worthlessness, guilt, fixating on past failures, self-blame. Trouble thinking, concentrating, making decisions, and remembering things. You used to have a good memory, memory's not so good anymore. You can't make any decisions or anything. Those are all things that could be stemming from depression. Frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide. Those are the big ones. And I think when we think of depression, most of the time we just think of somebody who's just suicidal. Or if you have depression, you're going to be suicidal. That's not always the case. You don't have to have depression to be suicidal. You don't have to be suicidal and be depressed. I mean, most of the time, they might go hand in hand, but just because you have depression doesn't mean you're going to be suicidal. Unexplained physical problems such as back pain or headaches. So, if you're constantly getting headaches, migraines, mental issues can lead to physical problems. The mind is a very powerful part, and it will, or it could lead to actual physical problems if your mind is not up. So we could have several causes. Biological, people with depression appear to have physical changes in their brain. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the functions and effect of these neurotransmitters and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones. Change in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy during the weeks or months after delivery, which would be your postpartum, and from thyroid problems, menopause, or a number of other conditions. I know we've heard mothers with their postpartum depression. The hormones have a lot to do in the chemistry and everything that goes on in your brain. So any of those changes could lead to depression. And because of the things that we know like that, we are able to, or they are able to prescribe medicine in order to help regulate the hormones and the neurotransmitters and everything, which could help you relieve some of the symptoms and even just some of the severity of the symptoms, to where maybe even if they don't get rid of your symptoms aren't so bad anymore. Inherited traits. Depression is common in people whose blood relatives also have this condition. So researchers are trying to find the genes that may be involved in causing depression. So there's still a lot of uncertainty about what causes everything. The brain is very complex, and so therefore it's hard for us to study exactly what it is that is going on. So when to see a doctor. If you feel depressed, make an appointment to see your doctor or a mental health professional as soon as you can. If you are reluctant, just talk to a friend or a loved one, any healthcare professional, faith leader, someone that you trust. If you're contemplating suicide, call your doctor or mental health professional. We got the suicide hotline there. So you can reach out to a close friend or loved one. Again, you can contact a minister, spiritual leader, or someone else in your faith community. So we got this video here.
Serial
Share the screen.
Procrastination is something that affects 80% of the population. Even high-performing, intelligent
This is Todd. Todd wakes up at 7 a.m. to go to the gym. It's his favorite part of the day. Todd then goes to class. He never skips classes and is an excellent student. Todd catches up with some friends after class before going home to eat dinner with his housemates. Todd loves to eat. Lately, Todd hasn't been feeling like himself. He has trouble sleeping at night. He doesn't feel motivated to work out in the gym in the morning like he used to. He's been having trouble concentrating in class and is losing his appetite. Todd's friends are worried about him and encourage him to go see a doctor. The doctor asks Todd to fill out a lifestyle questionnaire. The doctor analyzes Todd's symptoms and diagnoses him with major depressive disorder. Todd does not want to tell anybody about his depression, worried about what his friends might think if they found out. Don't worry, Todd. I will explain all there is to know about depression and clear up any misconceptions. To start off, what exactly is depression? Major depressive disorder is a mental health disorder characterized by persistently low mood. The average length of a depressive episode is seen to be 6 to 8 months. According to a study done by Rott and colleagues, nearly 20% of people will experience a major depressive episode at some point in their lives. Some of the major emotional symptoms include deep feelings of sadness, reduced interest in previously enjoyed activities, low sexual desire, restlessness, feelings of worthlessness, constant irritability, social withdrawal, and recurrent thoughts of suicide. There are also many physiological symptoms associated with depression. Some of the most prevalent include unintentional weight loss, insomnia, loss of energy, and even slowed movement or speech. Depression can really affect you in the long run. Behavior caused by depression can cause a downfall in a student's academic abilities, disrupt meaningful relationships with loved ones, and lead to malnutrition. Therefore, it is very important to seek treatment. Major depressive disorder can result from a number of things, especially for a student. It is likely due to a complex combination of factors including genetics. People who have first-degree relatives who also undergo depression are at a higher risk themselves. Personal life events, tragic events such as the death of a family member, loss of a job, divorce, or any other type of stressful occurrence can increase chances of depression. Traumatic childhood, sexual or psychological abuse, neglect, poverty, and an unhealthy lifestyle are a predisposition to developing depression later on in life. Drugs and medication. Prescribed medications such as corticosteroids can cause side effects resulting in depression. The abuse of recreational drugs, including amphetamines, can increase chances of depression too. There are different ways to treat depression, depending on the severity of the disorder and other circumstances. First off, there are several antidepressant medications that act upon different neurotransmitters in the body. Selective serotonin reuptake inhibitor, or SSRI, is an example of a drug that increases the amount of serotonin in the brain, which is a neurotransmitter associated with happiness. Although there are many drugs that can be obtained to eliminate depressive symptoms, it is not a long-term solution. Cognitive behavioral therapy, CBT, and interpersonal psychotherapy are the two main types of therapies used to treat depression. They help individuals focus on the present and encourage the regaining of control over mood and functioning. However, the best solution is to have support from loved ones to help alleviate feelings of depression. For example, having a sit-down talk with family members to discuss practical solutions to ongoing problems can reduce symptoms of depression. There are many facilities here at the McMaster campus to help students deal with depression. One of them includes the McMaster Wellness Center, where students are able to talk to counselors, receive advice, and join therapeutic groups with individuals experiencing similar problems. Additionally, the peer support line at McMaster allows any student to call and talk to volunteers about what they are feeling. Unfortunately, in this time and age, there is still stigmatization associated with depression. However, both education and spreading awareness are key to ending the stigma that occurs in society. This negative stereotype of disgrace or discredit towards individuals experiencing mental illness sets them apart from others. Not only does it hurt the feelings of individuals experiencing depression, but it also causes them to feel like they are not good enough. This must stop. The results of a study done by Stengler-Wensky and colleagues displays that 45% of people surveyed reported concrete instances of stigmatization after receiving treatment for depression. However, through treatment, education, and understanding, we can suppress the effects of major depressive disorder. Our goal is to put an end to stigmatization and to create a comfortable environment for everyone. By coming together and understanding depression is common and perfectly acceptable in our society. For more information, please visit wellness.mcmaster.ca.
Okay. So now we are going to move on to anxiety, or generalized anxiety disorder, GAD. So muscle ache, soreness, impaired concentration, irritability, difficulty sleeping. So a lot of these are the same symptoms as depression. So your signs and symptoms, as we just said, feeling nervous, restless, tense, having a sense of impending danger, panic or doom, increased heart rate, hyperventilating, sweating, trembling, feeling weak or tired, having trouble concentrating or thinking about anything other than the present worry, trouble sleeping, GI problems, having difficulty controlling your worry, or having the urge to avoid things that trigger anxiety. So, like I said, a lot of these could be the same thing as depression. That's why it's important to not try to self-diagnose. If you're having these symptoms, you need to talk to somebody about it. Go see a licensed doctor. And they will be able to help you and figure out exactly what is going on. So the risk factors for anxiety may include trauma. Children who endured abuse or trauma, witnessed traumatic events, they are at higher risk for developing anxiety disorder at some point in life. Adults who experience a traumatic events can also develop anxiety disorders. Stress due to an illness. Having a health condition or serious illness can cause significant worry about issues such as the treatment and your future. You get a diagnosis of cancer or some other illness that makes you stress about what's going to happen. Stress buildup, a big event or buildup of smaller stressful life situations may trigger excessive anxiety. The example, death in family, work stress, ongoing worry about finances. I know for us, it could be stress about finals week or stressing about your grades here towards the end of the school year. Those things can cause you to have excessive anxiety and cause you to kind of shut down about things. Your personality. People with certain personality types are more prone to anxiety disorders than others are. So, other mental health disorders. People with other health disorders, such as depression, may also have anxiety disorder. Blood relatives with an anxiety, as we already said, it can run in the family. Drugs or alcohol, the use or misuse, withdrawal can cause or it could worsen anxiety. So, medical causes, heart disease, diabetes, thyroid problems such as hyperthyroidism, just like the depression, those things can affect your brain function and cause anxiety. Respiratory disorders such as COPD, asthma, the drug misuse or withdrawal from alcohol, anti-anxiety medications such as benzodiazepines or other medications, chronic pain or irritable bowel syndrome, rare tumors that produce certain fight or flight hormones can cause anxiety. We will watch this little video here. I can share it. There we go. And there we go.
Say you've got a huge presentation in front of all your colleagues. You're nervous. You've got quite a bit of stress leading up to the presentation. That stress is completely normal and really probably useful in certain situations since it can make you more alert and careful. After the presentation's over, you feel the stress start to fade away, right? Well, for 3% of the population, the stress doesn't go away. And maybe that stress isn't even brought on by a specific event, and it's always just sort of there. Either way, at this point, it's considered to be anxiety. That anxiety might get worse over time and cause things like chest pains or nightmares. Sometimes the anxiety is so severe that it causes someone to be anxious about leaving the house or doing everyday things, like going to work or school. This anxiety might be a sign of generalized anxiety disorder, sometimes shortened to GAD. GAD is characterized by excessive, persistent, and unreasonable anxiety about everyday things like money, family, work, and relationships. Even sometimes the thought of getting through the day causes anxiety. If the anxiety is persistent, then it doesn't seem to go away. If it's excessive, it's usually more than someone else might feel. And if it's unreasonable, they probably shouldn't have a reason to feel anxious about it. People who have GAD might even understand that their anxieties are excessive and unreasonable, but they feel it's out of their control and don't quite know how to stop it. People with severe GAD might be completely debilitated and have trouble with the simplest daily activities, or they might be only mildly affected and might be able to function socially and hold down a job. Sometimes the feelings might worsen or improve over time. In addition to having feelings of worries and anxiety, other symptoms include edginess and restlessness, difficulty concentrating or feeling like the mind just goes blank, and also irritability. And these psychological symptoms can also lead to physical manifestations of symptoms, like digestive problems from eating more or eating less. They might also have muscle aches and soreness from carrying tension in their muscles. Finally, difficulty sleeping is a really common symptom that can have a serious impact on physical well-being since the body's not resting. And this can lead to issues of chronic fatigue. Although the decision that someone's worry is excessive and unreasonable has a subjective quality, diagnosing GAD is aided by the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. This manual gives a list of criteria to meet in order to be diagnosed with GAD. First, the excessive worry and anxiety has to have been present for more days than not over the course of 6 months. In other words, a person should have the symptoms of excess or unreasonable worry on 90 or more days out of 180 days. Generally, people can't quantify or track their feelings in that way. So again, this is meant to offer a general guideline, right? Okay, second, the person finds it hard to control their anxiety, meaning that they have a hard time calming themselves or self-soothing to help themselves regain control over their feelings. Third, an adult must have 3 or more of the symptoms listed previously. In children, though, typically defined as school age, so between 6 and about 18 years old, only 1 symptom is needed for the diagnosis of GAD. Another criteria is that the anxiety causes impairment in important daily activities like school or work. For example, they might miss deadlines or find it difficult to even go to work because of their symptoms. Fifth, the symptoms are not attributable to the physiologic effects of drugs or medication, or due to a medical condition like hyperthyroidism, which creates an excess of thyroid hormone, which can sometimes cause symptoms of anxiety and worry. Finally, their anxiety isn't better explained by another mental disorder, like social phobia or panic disorder. Just like a lot of other mental disorders, it's unclear exactly why some individuals develop generalized anxiety disorder, but it's thought to be a combination of genetic and environmental factors, as it seems to run in families. It also has been shown to be twice as prevalent in females than in males. Treating GAD, like many mental disorders, may involve psychotherapy, medication, or a combination of the two. If it's psychotherapy, cognitive behavior therapy has been effective since it teaches the patient to think and behave in different ways and react differently to situations that would usually cause anxiety and worry. Medications like benzodiazepines or antidepressants might be prescribed as well. Benzodiazepines are a type of psychoactive drug that have a relaxing and calming effect. Antidepressants might also be prescribed, like selective serotonin reuptake inhibitors, or SSRIs, which regulate the serotonin levels in the brain and help elevate mood. Even though both medications and cognitive behavior therapy have similar effectiveness in the short term, cognitive behavior therapy has major advantages over medication in the long term, due to unwanted effects of the medication like tolerance, dependence, and withdrawal.
Okay. Go back to slideshow. All right. And so now, finally, our last one we are covering is schizophrenia. So who already, I know most people's heard of schizophrenia, but what do you think of when you hear the word schizophrenia? Do you think of a crazy person? Someone who's probably violent all the time? So they have lack of emotion, delusion, hallucinations, disorganized thinking. So your symptoms of schizophrenia, you get your delusions. They are false beliefs that are not based in reality. For example, you think that you're being harmed or harassed. Certain gestures or comments are directed at you. You have exceptional ability or fame. Another person is in love with you. A major catastrophe is about to occur. Delusions occur in most people with schizophrenia. So you have hallucinations. These usually involve seeing or hearing things that don't exist, yet for the person with schizophrenia, they have the full force and impact of a normal experience. They can be in any of the senses, but hearing voices is the most common hallucination. So basically, you're hearing voices to people with schizophrenia, even though there is no voice. It sounds like somebody is right beside you talking to you. Disorganized thinking, speech. So it is inferred from disorganized speech. Effective communication can be impaired, and answers to questions may be partially or completely unrelated. Rarely, speech may include putting together meaningless words that can't be understood, sometimes known as word salad. Extremely disorganized or abnormal behavior. It may show in a number of ways, from childlike silliness to unpredictable agitation. Behavior isn't focused on a goal, so it's hard to do tasks. Behavior may include resistance to instructions, inappropriate or bizarre posture, a complete lack of response, or useless and excessive movement. And you have negative symptoms. Your negative symptoms refer to reduced or lack of ability to function normally. For example, the person may neglect personal hygiene or appear to lack emotion, doesn't make eye contact, doesn't change facial expressions, speaks monotone. Also, the person may lose interest in everyday activity, socially withdraw, or lack the ability to experience pleasure. Schizophrenia, most of the time, you aren't born with the symptoms. They start probably in males around 25. You're about your mid 20s. Females a little later, probably around 28 to 30 is when the onset will start for them. So there is no known causes of schizophrenia. Your risk factors may include having family history of schizophrenia. So if you have somebody in your immediate family, there is a chance that you are going to develop schizophrenia, but it doesn't guarantee that you will develop schizophrenia. Some pregnancy and birth complications, such as malnutrition or exposure to toxins or viruses that may impact brain development, which is another reason why if you are pregnant, you need to make sure you're taking care of yourself, eating right for you and the unborn child. Taking mind-altering, psychoactive, or psychotropic drugs during teen years and young adulthood. So taking anything that's going to mess with your brain could wind up messing with it permanently and completely altering the functions of the brain and how the brain works.
Schizophrenia was first identified more than a century ago, but we still don't know its exact causes. It remains one of the most misunderstood and stigmatized illnesses today. So let's walk through what we do know, from symptoms to causes and treatments. Schizophrenia is considered a syndrome, which means it may encompass a number of related disorders that have similar symptoms but varying causes. Every person with schizophrenia has slightly different symptoms, and the first signs can be easy to miss. Subtle personality changes, irritability, or a gradual encroachment of unusual thoughts. Patients are usually diagnosed after the onset of psychosis, which typically occurs in the late teens or early 20s for men and the late 20s or early 30s for women. A first psychotic episode can feature delusions, hallucinations, and disordered speech and behavior. These are called positive symptoms, meaning they occur in people with schizophrenia but not in the general population. It's a common misperception that people with schizophrenia have multiple personalities, but these symptoms indicate a disruption of thought processes rather than the manifestation of another personality. Schizophrenia also has negative symptoms. These are qualities that are reduced in people with schizophrenia, such as motivation, expression of emotion, or speech. There are cognitive symptoms as well, like difficulty concentrating, remembering information, and making decisions. So what causes the onset of psychosis? There likely isn't one single cause, but a combination of genetic and environmental risk factors that contribute. Schizophrenia has some of the strongest genetic links of any psychiatric illness. Though about 1% of people have schizophrenia, children or siblings of people with schizophrenia are 10 times likelier to develop the disease, and an identical twin of someone with schizophrenia has a 40% chance of being affected. Often, immediate relatives of people with schizophrenia exhibit milder versions of traits associated with the disorder, but not to an extent that requires treatment. Multiple genes almost certainly play a role, but we don't know how many or which ones. Environmental factors like exposure to certain viruses in early infancy might increase the chance that someone will develop schizophrenia, and use of some drugs, including marijuana, may trigger the onset of psychosis in highly susceptible individuals. These factors don't affect everyone the same way. For those with very low genetic risk, no amount of exposure to environmental risk factors will lead them to develop schizophrenia. For those with very high risk, moderate additional risk might tip the balance. The antipsychotic drugs used to treat schizophrenia have helped researchers work backwards to trace signatures of the disorder in the brain. Traditional antipsychotics block dopamine receptors. They can be very effective in reducing positive symptoms, which are linked to an excess of dopamine in particular brain pathways. But the same drugs can make negative symptoms worse, and we've found that negative symptoms of schizophrenia may be tied to too little dopamine in other brain areas. Some people with schizophrenia show a loss of neural tissue, and it's unclear whether this atrophy is a result of the disease itself or drug-induced suppression of signaling. Fortunately, newer generations of antipsychotics aim to address some of these issues by targeting multiple neurotransmitters, like serotonin, in addition to dopamine. It's clear that no one transmitter system is responsible for all symptoms. And because these drugs affect signaling throughout the brain and body, they can have other side effects like weight gain. In spite of these complications, antipsychotics can be very effective, especially when combined with other interventions like cognitive behavioral therapy. Electroconvulsive therapy, though it provides relatively short-lived relief, is also re-emerging as an effective treatment, especially when other options have failed. Early intervention is also extremely important. After months or years of untreated psychosis, certain psychoses can become embedded in someone's personality. And yet, the dehumanizing stigma attached to this diagnosis can prevent people from seeking help. People with schizophrenia are often perceived as dangerous, but are actually much more likely to be the victims of violence than the perpetrators. And proper treatment may help reduce the likelihood of violence associated with schizophrenia. That's why education for patients, their families, and their communities helps erode the stigma and improves access to treatment. Continue to educate yourself about the symptoms, causes, and treatments of different mental health conditions with this playlist.
Okay. So that is pretty much all we have for today. So those are just 3 of the many mental illnesses that someone may have. Each of these has a lot more information than what we went over here. And we should not use this information for self-diagnosis. It is good to know the symptoms of a mental illness for yourself or a loved one. So when looking at the symptoms, you might be able to suspect you or a loved one or even a friend may have one of, and it'd be good to talk to them about it. And maybe even see about possibly going to get medical attention for it. So only a doctor should diagnose someone, and they are the ones that will be able to provide the medical help for the symptoms, such as prescribing medication, or you can go to your general practitioner, family doctor, and they would be able to help point you to a more specified doctor, a specialist for the disease to help you. So I want you to think about, do you know someone who suffers from mental illness? Do you think someone you know might suffer from one of these mental illnesses? So what symptoms, if any, do they have in common? Like when we were looking at depression and anxiety, what symptoms did they have in common? So again, I want you to complete the worksheet, and at the bottom, these questions that I just gave to you, go ahead and just write me out something real quick. Doesn't have to be long, just real simple. And let me know what you think. So that is all for today. Until next time, bye.